Good evening, everyone, and thank you for joining for the Center of Advocacy and Social Justice Autism Awareness Town Hall. My name is Sadia Barge, the intern coordinator here at the Jacksonville Urban League Center of Advocacy and Social Justice, and we're grateful to have you to join us for this important conversation focused on understanding inclusion, community support, and tips for autism awareness. Tonight, we have our special guest, Maria Almariri, as well as a few of our interns who are here with us at the Center of Advocacy and Social Justice. And tonight we will have coordinated this event. We have Lena. And so I'm going to go ahead and pass it over to her so she can introduce our amazing speaker for tonight.
Hi, everybody. My name is Lena. I am one of the internee for this program, and I'm gonna introduce my speaker for tonight. Maria Almariri is a senior biology major at Georgia Gwinnett College with a strong passion for neuroscience and child development. She has hands-on experience working with children on autism spectrum through roles at Social Skills Autism Camp and as a registered behavior technologist with applied behavior approach. Um, Maria provides one-on-one applied behavior analysis therapy to children with autism and developmental disability, implementing behavior intervention plans, fostering communication and social skills, and tracking progress with data-driven approach. Her goal is to pursue her PhD in neuroscience focused on autism and neurodevelopment disorder. Maria's research journey include presenting in her study. The research she has done before is the antioxidant effect of black seed and that create symptoms with strengthen her dedication to scientific inquiry and advocacy for children with special needs. Thank you, Maria, for joining us tonight, and we are very happy to have you tonight. And I'm just gonna let you go now.
Hi guys, my name is Maria Almariri. So I'm currently at Georgia Gwinnett College and I'm a senior and I'm studying biology. My future career is going to hopefully be going into the PhD in neuroscience. I'm very interested and fascinated by how the brain works and its different functions, whether it be cognitive decline, like neurodegenerative diseases such as Alzheimer's or dementia. And one thing that has really got me into that is working with children with autism. And tonight I'm going to kind of go over what autism is, raising awareness for it, and things like that. So I'm going to share my screen. I have a presentation that I'll pull up right now. All right, can everybody see my screen?
Yes.
All right. Also, I want to thank Jacksonville Urban League for allowing me to be the speaker tonight. So let's just get into it. So what is autism? Sorry, let me remove this off the screen so I'm able to be able to see the full thing. Okay. So autism or ASD, autism spectrum disorder, is a neurodevelopmental condition. It affects many things like social interactions, behavior, sensory processing, or communication. The reason that is ASD spectrum is because it has a wide range of diagnosis. Different individuals have different strengths and challenges, and they all have very unique differences. So it's very hard to just diagnose somebody with just autism, and that's why they have it as a spectrum. And it's very important to understand that autism is not a disease. It's not a disease that just happens overnight, or something that just comes up later on in life. It's just a different way of brain development that occurs during the developmental stages in the mother's womb, and during birth. So there's about, according to the CDC, about 1 in 36 children are diagnosed with ASD, and this extends across all ethnic, racial, and socioeconomic backgrounds. It's not specific to just one area of the world or one country of the world or a specific race. It's everywhere. Autism can be diagnosed anywhere around the world, and they've actually found that boys are more likely to be accurately diagnosed with ASD than girls. It does not mean that girls do not have autism. They actually do a very good job at masking their autistic tendencies. So that's why women are very underdiagnosed when it comes to autism versus boys. So it's a neurodevelopmental difference. So that basically means that the brain is processing the world in a very unique way. It's very different than what a neurotypical child is. And I just want to emphasize, when I say neurotypical and neurodivergent, I'm referring to children with autism or are on the ASD. And neurotypical is just the typical neural functions of a typical child that is not born with autism spectrum disorder. So there's many ways that we're able to differentiate between neurotypical children and neurodivergent children. Neurodivergent children have not necessarily difficulties, but different ways that they express communication and the way that they socialize. And it also includes a lot of different aspects of like sensory processing, and that ties into the neurodevelopmental stages that the children are experiencing versus a neurotypical child. So communication ties in a lot with socialization of autistic children. They may be nonverbal, completely nonverbal, or they may be very verbal or only use a few words to communicate with others. Some students or some clients that I work with have a AAC device, which is a device that they use to communicate with us for their needs and wants. Some use pictures, some use gestures, or some will even use songs to communicate with you, which is very unique to each individual. So, sensory processing, this is directly tied into individuals with autism. So they might be very sensitive to sounds or lights or textures or foods or many different things that is overwhelming for their brain to process. So they might also seek reinforcing sensations like movement or pressure. I have multiple clients that really, really like tight hugs. The sensation of the pressure on their skin is very reinforcing for them, and it makes them feel comfortable and welcomed. And we also have some clients who are very, very sensitive to certain sounds or loud noises, or maybe it could be very simple things like the crunching of a water bottle that they're very sensitive to. So the way they process different senses is very different than a neurotypical child. When it comes to socialization, one of the key factors that autistic children exhibit is social skills or lack of social skills. They sometimes just want to play alone, or sometimes they can only play with one person at a time. Sometimes being in a group of multiple people or in a very loud environment, they're not really able to fixate on one thing or one individual. So it really varies from child to child. Also, the way that they show their feelings or emotions is very different than what a neurotypical child. Neurotypical children, most of the time, they're able to verbalize what they're feeling and verbalize their emotions, but a lot of neurodivergent children are not able to do that. So they might show their emotions in very different ways. Sometimes it's very a dramatic approach to how they're expressing how they feel to you, or sometimes it's very difficult to understand what it is that they want. So this is a very big question, and it's also very controversial. And I want to touch on that later on in the presentation on where autism comes from. And doesn't really come from one specific thing. So we don't fully know where autism stems from exactly, but research does suggest different things that are, it's just an umbrella of causes, and it's present at birth. And I'm going to emphasize this a lot as we go through, that this is something that happens during the developmental stage. The brain is not developing like a neurotypical child's brain would develop in the womb. So there's several things that go on during the development of the brain in those stages. So environmental factors have also been shown to increase the risk of having a child with autism. It does not mean it's a direct cause, but there is a correlation. So that's very important to understand as well. Pollution has been shown. There's plenty of research that you can actually look up on the NIH that talks about how pollution and how different environmental factors are actually affecting the developmental stage in the womb. So that may increase the risk, but it doesn't mean that you're more than likely or less than likely to have a child with autism, but it's definitely, there's a correlation there. Also, different pregnancy complications can increase your risk of having a child with autism. So when I'm talking about brain connectivity over closer regions versus further regions, there's during the developmental cycle or the process, there's a stage as the child is developing where the body or the brain is getting rid of multiple neurons that are no longer going to be in need or in use later on in the child's life. However, with children who are neurodivergent, these neurons actually stay in the brain. They don't exit the body, they're not removed, they just stay in the brain. And this causes a network of neurons that are constantly firing between very close regions in the brain. So it could be the frontal lobe and the region right next to it where there's a lot of communication going on, hence the overload of sensory, or they're not being able to process different sensories as a neurotypical child would. Versus the further regions, there's actually not a lot of communication going on in those areas, which is something that can actually be changed over time once I get into applied behavioral analysis and the different therapies that have shown to progress those brain connectivities between further regions and closer regions of the brain. So again, the causes of autism are not very clear. There's a wide range and variety of what exactly is causing autism. But one thing I really want to emphasize is it is not caused by vaccines. It is not caused by parenting style or any actions that are taken by the families or their caregivers or anybody that is in their environment. So again, they are not caused by vaccines. There's not a single research that is pointing towards that vaccines are directly causing autism, and there's also no correlation between the two. And parenting style also does not fit the cause of autism because this is happening again during the developmental stage of the child in the mother's womb. So it's not happening once they come out later on in life because of the way a mother or father is raising their child. This is directly happening during the developmental stages. So I'm gonna give a couple examples that maybe you've seen this in somebody that you know who has autism, or you've worked with people who are on the spectrum, or you have a family member, or you are somebody on the spectrum. I'm gonna touch up on some of the sensory overload that they experience. I talked a little bit about how loud noises or disruptive areas can overwhelm a child with autism. So I have a lot of clients, if there's a very loud video going on in the background, or if too many kids are in one area and they're all, doing their own unique little stims. Stimming, by the way, is a sound or a hand movement or something that they do repetitively that helps soothe them, especially in loud environments, or whenever they're having some kind of like anxiety, or they're just looking to self-soothe. Like a lot of people hum sometimes when they're feeling a little bit anxious, or they're trying to calm down. Children with autism, we call it stimming, and some of them make sounds, some of them make hand movements, some of them spin. Like there's each one is very unique. So I have students who will sometimes cover their ears if there's a loud noise, like if they hear a vacuum or a leaf blower in the background, they get very overwhelmed and they have to close their ears. So why do these kids do that? And it ties back to the differences in neural connectivity that I talked about in the previous slide. So there's a part of the brain that is processing sight, sound, touch, or taste, and it's very, very sensitive because of the presence of those extra neurons that were not shed during the developmental cycle. So it can be very loud, it can be very overwhelming, and sometimes actually it causes them physical pain when they hear loud sounds, or if they see too much light in around surrounding them. So they're very sensitive to that. And it's very important that when I do see a client covering their ears because something is very loud, I make sure that I'm able to either take them out of the environment, or I'm able to reduce the sound that is happening, because it's not just they don't want to hear it, or it bothers them or anything like that. It's important to respect their boundaries and respect their requests, because this is something that neurotypical people don't normally we can't really understand or comprehend what they're feeling. If I were to take a leaf blower and just turn it on behind you, you'd get startled and maybe like walk away and ignore the sound, versus somebody who is on the spectrum, it's very, very overwhelming, and it's really important to be able to reduce that sound or take them away from that environment. So even if I need to give them like some quiet time, sometimes wearing headphones really helps. Even people who have neurotypical children who are sensitive to sound, you'll see them wearing those big bulky headphones, and that helps to reduce those overwhelming sensations. Um, and then again, it's not a disease. It's not something that is pointing towards you have a damaged brain, or that there's something wrong with you. It does not equal that at all. There's absolutely no correlation between having a neurodivergent brain and having a damaged brain. Your brain is just processing things differently than what a neurotypical brain does. Here's another one. They tend to repeat a lot of phrases or words. So, um, for example, I have a client who, when I say something, or I'm asking her to do an action, like for example, if she's showing a maladaptive behavior, like hitting or snatching or anything like that, I'll prompt her to have gentle hands or nice hands, and she might continue to do that action, but she will be repeating what I said. She'll say, "Nice hands, gentle hands, nice hands," over and over again, even if she hasn't yet understood that I'm tying it to the action of hitting or snatching. So why does she do that? Why does she repeat what I'm saying instead of following that direction? So this is called echolalia, and it's in the word echo. They echo what it is that you're saying, and this is their way of helping them process what was said, and this is their way of learning and communicating with with people, because again, their communication style is very different than a neurotypical child's communication style is. So if they don't have a way to respond, or if they're still not yet understanding what it is that I've asked them to do, they'll tend to continue repeating that word or that phrase over and over again. And over time, they're able to connect that phrase with the action or the command that I'm asking them to do. So it's a form of communication, but it also shouldn't be taken literally, because they will tend to repeat that phrase or word during situations or settings where it's completely unrelated. So we could be eating lunch during lunchtime, and she's eating and she'll keep saying nice hands, gentle hands, even though it has absolutely nothing to do with her picking up her fork and eating, but she's still learning to process that phrase or process that word and have it connect to the action. So it shouldn't always be taken literally, but at the same time, don't um don't try to navigate them towards saying something else or correcting them, because you should in fact be acknowledging it and encouraging them. And sometimes I'll even repeat the phrase after she's repeated it, and I'll be like, that's right, we have gentle hands, like good job, we're using nice hands, or we're using nice words, and all these things. And that encourages her or him, the client, to continue to make that connection with their brain, um, for the action that I've told them to do previously. So, how is autism diagnosed? There's a lot of early signs of autism. They're normally present from birth up until the ages of 3 or 4, where they have a lack of eye contact. You kind of see them, their eyes are wandering, they're not maintaining eye contact. If they hear a sound, their eyes don't direct towards the sound. When you're speaking to them or when you're engaging with them, it seems like they're very unresponsive. So that's a very big sign of, or early a sign of autism. The other one is speech delays. Maybe by the age that they are supposed to be babbling or talking or saying small words, they haven't reached that, so they have speech delays. There's also motor skill delays. They're not able to pick up a pencil, or hold scissors, or hold a fork and feed themselves. Even when a neurotypical child normally learns how to grab things with their hands and hold on to things with their hands. So there's a lack of motor skill. There's soft motor skills and other things like that. So the way that this is diagnosed, normally a parent does it raises concern, it raises questions for them when they do exhibit their child showing these kinds of symptoms or signs of autism. Psychologists and physicians will normally collaborate together. So to have a proper diagnosis for this, the psychologist will conduct different behavioral evaluations, speech language assessments. They'll also observe the individual in different environments and different settings in order to create a proper diagnosis. And we do this at my ABA clinic. Whenever we do have a child that has been recently diagnosed with autism, they come into our clinic for an assessment, and during this assessment, we'll present them with different toys, different foods, different items, and videos or anything like that. And we'll observe their reaction towards these different items and foods and all these things. And we'll observe how they react towards it, or if they like these items, or if they don't. We also observe how they interact with peers, other children, adults, and we'll also ask the parents questions if they experience any kind of abnormal behaviors that you wouldn't normally see a neurotypical child um, exhibit. So there's many things that go into diagnosing children with autism. It's not just one specific thing. It takes a lot of tests. It takes a lot of diagnostics and all these things to get a proper evaluation and a proper diagnosis, which luckily we've definitely progressed in recent years on properly diagnosing autism and catching it earlier on. And there's a lot of co-occurring conditions that do tie in with autism. So not all individuals with autism have these conditions. Some of them have one, some of them have two, some of them don't have any of these conditions at all. But most autistic kids or people with autism have ADHD. So it's very hard for them to sit in one place or focus on one thing. They could be very hyper, um, constantly moving around, very busy bodies. Sometimes I've had clients who just cannot sit still during lunchtime. They'll stand on the chairs or they'll walk away from the table, start spinning around, doing different things. So that's something that you see a lot with children with autism. And that's also a behavior that we do focus on and helping to have a better outcome with that. A lot of them do also have anxiety, sensory processing disorder, which is the overload of taste or sound or sights and all these things. Um, Epilepsy also, and gastrointestinal issues. A lot of them are very picky eaters. Some of them, if it's a very severe GI issue, like ARFID, which is a condition where they're not able to keep food down because of the textures and because of how overwhelming those textures or those tastes feel when they're eating, and it causes them to lose weight, have nutritional deficiencies, and a lot of very negative effects. So these are a lot of conditions, and there's more, but I just wanted to put a few on here. And again, not all autistic kids or autistic individuals experience these conditions. Some have one out of these, or multiple, or none at all. So it varies. It varies from each individual. So because autism is a spectrum. We do have different levels that, especially in schools and school environments where they're placed in different classes to meet the children's needs. Level one is only where the child or the individual needs very minimal support when it comes to different areas of their lives, whether it be behavioral or occupational or speech or any of those things. They're very high functioning. So you might meet an individual that is on the spectrum and doesn't seem like they are on the spectrum. Um, it's very easy to talk to them. They're very verbal. They're very easy, they seem like a neurotypical child. So, but they're still on the spectrum because they exhibit certain things like repetitive behaviors or other things like that. So that's level one. Level two, children or individuals with autism require substantial support, so they need more focus on some specific areas in their lives that we need to put more attention on those things and help them with those things. So it could be social skills, or it could be a behavioral problem that has been occurring repeatedly, and we need to support this child or this individual with it. Level three requires heavy, heavy support, very significant support. And many of these level three individuals are nonverbal, or they exhibit certain behaviors that are not very typical for a child or individual. So the support differs. We don't just focus on, again, we don't put them all in just one category. It's a spectrum, and different individuals need different support and different help. And it's really important to understand that you won't meet one autistic child or one autistic individual that is the same as another autistic individual. So, how can we help as a community, or how can we help as teachers and educators and physicians and healthcare? It's really important to be supportive. That's the number one thing. Being very patient with them, accepting them for their differences. They think differently, they play differently, they talk differently, they um communicate way differently than a neurotypical child will communicate. And it's important to be very patient with these individuals. So follow their lead. And again, autism, it's not something that you can cure. um it's something that is just it's a different developmental delay, different developmental disorder. These are different interventions that we apply. Again, I work in an ABA clinic, so we do different things like play-based therapy, speech therapy, occupational therapy. We break difficult tasks into smaller steps. And as a community, especially in schools, in the media, and different educational or clinics, we need to be able to accept these people for their unique differences and to encourage them and acknowledge their differences because they live a different life and they view things in a different light than we do. So it's very important to acknowledge these differences. Here's some resources that I've placed here that you guys can look into. And I've also put some famous autistic individuals in history and throughout modern day society that have made very huge contributions to our world today. So definitely take a look into these people. It's very interesting to know that, or a lot of people don't know that these individuals are on the spectrum. So in closing, more awareness is going to equal more understanding, more acceptance, and more inclusion. So every individual on the spectrum deserves the respect and the support and a place to thrive in our community. Thank you, everybody. And I've placed my email at the bottom if anybody has more questions they want to reach out.
Thank you, Maria. Thank you so much. I actually appreciate your speech, and it was very, very, very nice to know all of this about autistic kids. And I just have many questions here. I just gonna go ahead and ask you one of them, so the other guests can go ahead and if they do have any questions, so they can ask you. So my question is, what advice would you give to college students or young professionals who wants to advocate for autism awareness in their communities?
Um, Definitely start by educating yourself on autism and really understanding what it is and knowing how to navigate or accept others who are on the spectrum. You can definitely there's a lot of resources, there's a lot of different communities that have outreach for kids with autism or individuals. There's a lot of adults who actually get diagnosed with autism later on in life. So definitely educate yourself more on autism and what it is and how you can support people with autism because it's progress is really important. They look at things very differently than we do. So, and as a student, if this is something that it is that you're very interested in, definitely take a couple psychology classes or watch some videos on YouTube. There's a lot of really good videos that dive into it and look into the research already that's already been done on autism.
Mhm. Yeah. So any any of my kid guests, sorry, needs to ask any question here?
I would like to ask one question.
Mhm.
We here at the Center of Advocacy Social Justice also like to focus on policies and things of that sort. So thinking about policy level actions, what kind of policy changes or things would be most meaningful to help autistic individuals and their families, do you think?
I definitely think, especially currently, if you guys have been watching the news and staying informed when especially when it comes to the new changes that are happening in public health with the CDC, there's been a lot of false claims and a lot of myths that are being posted on official websites and official news outlets of false things like vaccines causing autism, or if you take Tylenol when you're pregnant, then you're going to have an autistic child. It all comes down to educating yourself and looking at the research and looking at what is there already that has solidified the research that we do have on autism. A lot of policy changes need to be made, especially right now, because we have a lot of people in this current administration who are actually doing the opposite of raising awareness for autism and giving them the special help that they need. And this applies to people with other disabilities as well. So definitely as communities, we need to come together and we need to educate one another on how we can help these individuals progress and make it far in life, because a lot of them are very, very intelligent and very unique people, and they're very, very fascinating to be around, and they show you the world in a different light. So educate yourself, do your research, don't just, look at everything that's being splayed out on the media or on social media, and really look at what is already there and the research that we already have on individuals with autism. That will definitely help. And like, this is a town hall, so this is what this is for, is raising that awareness and letting people know.
Oh, thank you so much for your answer for that. Um, do anyone else have questions?
Um, if uh, if if you guys have no more question, I just gonna ask Maria one more question before we close and leave this meeting. So I just want to ask you, Maria, what inspired you to focus your academic and professional journey on autism awareness and behavior therapy?
It's definitely just started off as something small, like doing volunteer work. I was also babysitting somebody who was on the spectrum, and he had a very huge impact on me. And he was very, very smart. He was nonverbal, but he was able to communicate in very unique ways. He would show me YouTube videos or TV shows to tell me what he wanted, and he was able to do things at such a young age that, like, a neurotypical child wasn't able to do. He could remove a remote piece by piece and then put it back together with no background knowledge on it at all. And that's what really sparked my fascination with it. Um, the following year, I started volunteering at a social skills camp, and it was a summer program, so we just got to, like, have fun with the kids and play outside with them and do different activities. And I got to meet so many different children, and they were all so unique and so different, and just really, it was really, like, lovely to be around them. And um I've been around kids with autism for about, like, 5 years now, and I started my RBT training at an ABA clinic, and from there, I just really started looking into it more and more, and I did my research project, on campus, and I really got into researching, and that's something that's also pushed me to learn more about the brain and other disorders and other diseases, and how we can help diagnose them properly and find better alternatives or better cures for different neurodegenerative diseases, and how we can help progress more research on autism.
Yeah, that was a great answer. Thank you so much, everybody, for attending this meeting tonight. I appreciate you. And thank you, Maria, for having us. And thank you for everything you have prepared
Thanks for
for
having
us.
me.
Yeah, it was a pleasure having you tonight. And
Alrighty.
and
So, on behalf of the Jacksonville Urban League Center of Advocacy and Social Justice, we want to thank you all again and wish everyone a good night. Continue to spread the word about autism awareness and make sure that you're being inclusive of, of these brilliant minds. We look forward to having more town halls on awareness, not only for autism, but other mental health issues and public health issues, as well as social justice. So make sure that you're staying connected with the Jacksonville Urban League. Thank you all and have a good night.
Thank you so much, Miss
Thank
Saudia.
you.
Have a great night. Thank you. Bye.
Have a good night. Bye bye.